Okay, think about how we actually manage health today. You get three different symptoms, you usually walk out with three different prescriptions, right? But what if there was a way to pinpoint the single most potent substance for your specific issue? Like a substance so ridiculously effective that it's just the absolute best choice, hands down. That's exactly what we're going to unpack in this explainer today. So this points to a massive problem in modern healthcare. Polypharmacy. We're literally taking more pills than ever, mixing compounds, and basically just crossing our fingers that they don't interact badly. But what if one single substance could actually replace an entire handful of pills? Now, this isn't just some hypothetical wishful thinking. It's a highly sophisticated, rigorously documented therapeutic strategy that actually started thousands of years ago. And, incredibly, it's being aggressively validated by modern science right now.
To really get this, we've got to look at this term, Agrya dravya. It comes from the Sanskrit roots agre bhavam, agra pradhanam, and Agrya literally translates to the foremost, the primary, or simply the absolute best among all substances. See, in classical Ayurvedic texts, an Agrya dravya isn't just a good remedy, it's the undisputed champion for a specific action or disease. It is the lead drug. So when a practitioner uses an Agrya dravya, they're picking a substance with maximum efficacy, unmatched safety, and super targeted therapeutic action.
So, here's the game plan for today. First, we'll define this foremost concept. Second, we'll look at the clinical power of single drug therapy. Third, we're diving into the top medicines, the Aushadha. Fourth, we'll see how this applies to diet and lifestyle. And finally, we'll wrap up with the modern scientific validation that's actually proving these ancient texts right. All right, let's dive right into Section 1, the foremost concept defined.
Now, I want to make it super clear. This is not just ancient philosophy. Peer-reviewed analyses in journals like the World Journal of Pharmaceutical and Medical Research are actively grounding this whole concept in modern, rigorous academic study. Today's researchers are combing through foundational texts like the Charkos Samhita, which, by the way, lists 152 of these foremost substances, to understand exactly why certain plants and practices were elevated above everything else. They aren't just looking at folklore here. They're actively studying the chemical constituents and clinical outcomes to prove their clinical importance.
Moving right along to Section 2, the clinical power of single drugs. So this builds our core understanding of treatment strategies. Think about the modern multi-drug approach. It can be super expensive, and it carries a really high risk of adverse interactions, mostly because it addresses symptoms in isolation. Now contrast that with the Ayurvedic concept of ekala dravya prayoga, or single drug therapy, which uses an Agrya dravya. Because this Agrya substance is so amazingly potent, one single drug can actually perform multiple therapeutic functions all at once. It's highly cost-effective, incredibly safe, and dramatically increases patient compliance because, well, you only have to remember to take one thing. Okay, let's get to the good stuff in Section 3, top medicines, or the Aushadha. First up on the list is guduchi, scientifically known as Tinospora cordifolia. In the ancient texts, this plant is literally referred to as ambrosia, or the nectar of life. Guduchi is designated as the absolute foremost drug for a condition called vata recta, which pretty much perfectly aligns with modern gouty arthritis. It's also a supreme immune modulator. So what actually makes it the Agrya, or the best? Well, it has this unique ushnavirya, meaning a hot potency, that miraculously manages to pacify the aggravated vata dosha without provoking the blood. This makes it a perfect, highly targeted anti-inflammatory intervention, a mechanism that modern research articles are actively validating as we speak. Next up, we have amalaki, or Amblica officinalis. If you're looking for the ultimate rasayana, meaning the foremost rejuvenating and anti-aging agent, this is it, folks. Amalaki is absolutely packed with a massive concentration of natural vitamin C and powerful antioxidants. But its status as an Agrya dravya goes way beyond just anti-aging. It's specifically highlighted in the texts as the supreme, best-in-class choice for managing prameha, which correlates to diabetes and metabolic disorders. And guess what? Clinical studies now completely support what these texts claimed centuries ago. Amalaki sustains youthfulness while actively repairing metabolic dysfunction. Then we've got pipali, or long pepper, which honestly perfectly demonstrates the sheer power of single drug therapy. It is the premier treatment for pliha roga, or spleen disorders, but just look at its action on the digestive system. Pipali acts as an appetizer, a digestant, and it relieves abdominal distension completely on its own. Think about it. If you were using a standard modern approach, you might literally need 3 separate pills to get those 3 actions. Pipali does all 3 simultaneously, just because it's the foremost substance for that specific bodily system. And it's not just exotic herbs here. Everyday foods are classified too. Take ikshu, which is literally just sugarcane. The text specifically identifies sugarcane as the absolute best substance for mutrajana, which basically means diuresis, or increasing urine output. So if a practitioner needs to aid urinary health and flush the system, they don't have to reach for a synthetic diuretic. The Agrya framework tells them exactly what the single most effective natural substance is. And again, this is a finding consistently backed up by modern pharmacological research.
Which brings us to Section 4, Diet and Lifestyle Rules, known as Ahara and Vihara.
Now, this brilliantly illustrates that Ayurveda isn't just about finding the best cures, it's about identifying the most potent causes of our health issues too. Modern nutritional science totally confirms this. For example, yava, or barley, is the foremost food for increasing fecal bulk to help with bowel movements. Simple enough. But consider kulatha, or horse gram. You'd think, hey, it's a healthy food, right? But the texts actually classify it as the foremost substance that causes acidity if you eat too much of it, due to its hot potency. Similarly, masha, a type of bean, is the foremost food for increasing kapha and pitta. This means a doctor knows exactly what to tell a patient to stop eating if they have a related imbalance. It's highly, highly specific dietary targeting. And the exact same logic applies to our lifestyle habits, or vihara. The texts identify upawas, or fasting, not just as some spiritual practice, but as the absolute foremost clinical action to relieve fever and systemic inflammation. Now contrast that with kalbhojan, which is simply the act of eating your meals at the proper, consistent time. Eating on time is classified as the Agrya, the #1 foremost lifestyle practice for maintaining baseline health and preventing disease. We're not talking about expensive therapies here, just the incredible power of the absolute best daily habit. And wouldn't you know it, modern clinical trials on fasting and circadian eating are proving these exact practices to be incredibly effective. Let's wrap things up with Section 5, Modern Scientific Validation. What's really interesting about this next piece of research is that modern studies, like the ones published here in the Ayushini International Interdisciplinary Research Journal, have found that these Agrya substances aren't just potent. Their maximum value is actually unlocked when they're used in the Purvarupa, or the early prodromal stages of a disease. Science confirms that because these drugs are the foremost in their category, deploying them early can literally halt the progression of a disease before it reaches the next stage. This proves them to be incredibly cost-effective and highly potent preventative tools. Let's look at a really specific clinical trial to bring this all home. This paper from the AUSHDHRA journal conducted a comparative clinical evaluation of Guduchi. Remember the ambrosia we talked about earlier? They tested it specifically for Vata Rakta, or gouty arthritis. This right here is where the ancient texts and modern pharmacology shake hands. The researchers essentially wanted to see if Guduchi truly lived up to its title as the Agrya Krasya, the absolute foremost drug for this really painful condition.
And honestly, the results are stunning. The study concluded, and I quote, Guduchi's beta-sitosterol and polysaccharides exhibit anti-inflammatory and uricosuric activity. This is literally the modern scientific translation of the ancient Ayurvedic mechanism, where the old text said Guduchi's Ushna Virya pacified the dosha and relieved joint swelling. Modern science steps in and says, yep, its beta-sitosterol actively stops inflammation, and its polysaccharides act as a uricosuric, literally helping the body excrete the uric acid that causes gout. The ancient classification of foremost was 100% biologically accurate. So what does this all mean for us? Why does the concept of Agrya actually matter to your health today? Well, it matters because it offers a significantly smarter way to heal. By identifying the single most effective substance for a condition, we can replace complex, dangerous polypharmacy. It makes health management highly cost-effective and accessible to everyone. It drastically reduces the risk of adverse drug interactions, and as we've clearly seen today, this isn't just a theory. It's an entire system backed by thousands of years of clinical observation and rigorous modern scientific validation. Which leaves us with this final, provocative thought. We so often debate whether we should rely on ancient wisdom or modern science, right? But looking at the power of Agrya dravya, it becomes super clear that true healing doesn't force us to choose between the two. Maybe the ultimate secret to health isn't about taking a dozen different pills and just hoping one of them works. Maybe the best medicine, the true foremost substance, is simply having the profound knowledge of knowing exactly which one to choose. Thank you so much for joining me on this explainer, and I really hope this empowers you to seek out the best, most targeted solutions for your own health.